about how we are managing the disease. As I speak, the communication aspect of COVID-19 is principally handled by the Ministry of Information, and I hope you are aware. It is for a certain reason, because we want to make sure the information is well packaged and that it is given out by the right person and also in the right context to avoid unnecessary speculation. And so therefore, we want you to respect all these protocols. And we also realize that Ghana High Service has actually set up a website and a portal where all the information on the reported cases have been put in there. And we are urging all media personnel to use that platform to access as much information as is possible for your work. I hope I'm very clear, because I wanted to set the stage right for our engagement. Because there have been cases of where we have even gone beyond the engagement that we are having with you and have issued statements, some of which are very, very clear. And yet, we still get a storm of calls. People come to our offices to have one-on-one engagement. People are inviting us to your studios. But like I've always indicated, those kind of engagements breaches the kind of protocol we are all expected to observe to help the country manage the COVID-19 better. It's about any kind of closeness. Yes, we are talking about the numbers, about maybe 25 or more. But it can even be one-on-one. The more closer you sit with anybody to have a conversation, it's a risk. And the reason why, if you come to Confederate now, we have even taken steps to decongest our outpatient department operations, the OPDs. Because we think that the health staff were at risk. The patients who are coming in there are also at risk. So strategically, we needed to have a way to space out our clients. So we have actually scaled up our appointment system to make sure that people who are coming to us are coming in on the dates and the times that they have been given. Of course, some few people will trickle in, but when they trickle in, they will still be seen under the protocol. The key focus is that we must decongest all our operations, and that's why we have even suspended all kinds of meetings in the hospital, except for where management will have to meet at the directorate level or the unit level or at the central management level to take some very urgent and emergency decisions. So I think I wish to use all these introductory remarks to admonish you to please hold on to the frequent calls and the frequent requests for the engagements. I, for instance, have said that as much as I can, and I'm sure as much as the regional director could, if you call and we are able to give you some piece of information, we will do so. But please, there are various sections, especially the official portal. There's so much information there for us to access information from. And we are also releasing statements and various media platforms to make sure that you get as much information as you require for your work. I think having said that, let me talk about the two cases that so far has come to reported in the region. As you may have read, we have two cases. The case one is a patient, 59-year-old, who lives in the UK and arrived in Ghana by British Airways on the 13th of March and got to Kumasi the day after on the 14th. And then 2 days later, this patient complained of a fever, cough, and general feeling of being unwell. So she reported to a private clinic on the next day, and that makes it the 5th day upon arrival in the country, where the suspicion was made there as fitting into the case description. So a sample was taken, and the KCCR at the KNUST, that's the Kumasi Center for Collaborative Research, did the test. In fact, they have done all the tests for the various cases of suspicion that we have had in the region so far, and it came out to be positive. The patient is currently being managed in isolation. The second case is also a 61-year-old Ghanaian with foreign roots, also resident in Kumasi, which I must say that probably is about the first case being reported that had no travel history. And this patient reported on the 18th of March, just 2 days ago, with a history of fever, cough. And at the time he was seen, various investigations were put in place. And in fact, the radiological investigation that came up, the chest X-ray, was quite suggestive. And quickly, a sample was taken, and the patient's sample came from the KCCR as being positive. This patient has also equally been admitted into isolation, and he's currently doing well. I think this is exactly what describes the two cases that we have had in the region lately, I must say, because there's one case earlier, as you are aware, which is also isolated in Obuasi, and it's also being taken care of. And I must say that all the three patients are so far doing very well under the treatment regime that are being given to them. I think Regional Director, our friends from the media who are here, this is how far I can go in terms of giving information. I'm sure we will admonish you subsequently in terms of your role in the risk management regime, because we expect you to really assist us and scale up in that particular aspect of managing COVID-19, the risk management, the communication to the public, to the citizenry, about the do's and the don'ts. And when you see some of these things, we expect that you raise issues with them and raise the issues even among yourselves. And we expect that you yourselves will also observe the protocol so that you do not put yourselves at risk. Because we need you in the fight against novel coronavirus, COVID-19. Thank you very much. Okay.
It's okay. Money shift there better. So. Maybe let me. Let's finish with the English and then. So, ladies and gentlemen, this brings to the number of cases in the Ashanti region to 3. So far, as a country, we have 16 cases. 16 cases. I think last week when we reported, there were 2 cases. So within a week, I think we've recorded close to 14 cases. The case that was recorded in Ashanti region, one of the cases had no travel history. And those in Accra, 3 of them also have no travel history. That means that you can be in this country and then get infected. And that's one area that we want you to understand. And that calls for risk communication. It means that whatsoever intervention that we've put in place, The president has said a lot, and what we are doing as a country is so important because we are not going to make any assumptions at all. Because this is a new virus, it's a new strain. We don't know the behavior of the virus. So we don't want anybody to be complacent. People who were talking about the temperature and other things, you've realized that despite the temperature, high temperatures, people are getting it here in Ghana. So if you are here, all that we want you to do is that you adhere by the principles that we are talking about and support us as the media to make sure that we adhere to what the president and everybody in this country is saying. And I believe that when we adhere by the principle, we can cut the transmission. Despite the fact that we are having cases in this country. I think this is the area that we want you to help us. One area that we want you to address for us is area of misinformation. We are having a lot of misinformation on the social media. People are talking about using hot water, using aquatation, using so many drugs to cure the disease. Please, this is not true. As at now, we don't have any vaccine. And I don't think that we'll have vaccine maybe in the next even 1 year, because there are certain processes that we'll have to go through if you really want to develop a vaccine. And that will not take you 1 day, it won't take you 2 months, because you have to try it on so many people before you can come up and say that this is a vaccine that you can use on masses. So we are not going to be very complacent at all. The number of cases in this country is going up, and we are in a battle. So let us fight together. You have to allow the medical system also to work. Confidentiality is the key when you come to any medical system. And nobody will be happy that we will go and portray what he's having on media and other things. So from now on, we won't give you any information relating to any patient at all. We are not going to do that.
What are the numbers?
We will tell you the numbers that we are having. We won't tell you where the people are coming from, because they are not coming from outside. They are not imported. We are getting Ghanaians who are living in this country and having cases. So this is exactly what we are going to do. The testing, we are only going to test those people who will meet the case definition. So if you call us that there's somebody hiding in your house and that we should come and test that person, we won't do it. The person will only have to fall under the case definition before the person will be subjected to testing. And this is exactly what we are going to do. We'll have to make sure that anybody who is tested falls under the case definition that we've already described. And this is exactly what we are going to do. So confidentiality is the key here. You have to support the medical system. If people feel that when they are diagnosed, you will expose them, they won't come out and they won't help the system. So let's make sure that in the quest to communicate, we don't do something that will affect the way we are going to manage the disease in this country. We need your cooperation because the cases are going up, and to be very sincere with you, we'll have to have more cases before it will go up, before it comes what? It comes down. So don't be very scared if you see the number of cases going up. The most important thing is that adhered by the simple principles that we keep on talking, and this is the area that we want the media to support us. Support us with the risk communication. Communicate the risk so that people will adhere by those principles. Last week we had a challenge in Kumasi where we saw some pastors were so recalcitrant they wouldn't even listen to what the president was saying. Together with the regional minister, we've decided that if you don't adhere by the principles, we'll also have to apply the rules. So we want all of you, every Ghanaian should be obedient as far as the rules and regulations in this country is concerned. Let's make sure that we are law-abiding. All that we are doing is in your own interest, because we want you to be alive so that we can build this country. The other nations, you can talk to your brothers and sisters in the European countries. They will tell you what is happening here. We don't want those situations in this country, and the health system is going to make sure that we also support the government of Ghana to ensure that we make every Ghanaian living here so safe. So this is a short message that I have for you. Thank you. We would like to open the floor for whatsoever you have. Later we will add the tree, and then maybe we close everything. So let me where can tree now? And I income. So what's that?